At this time, it's just about 2 o'clock, so we are going to move on to our next session. We've got Sarah Kendall here with TWC VR. She's going to talk about supported employment and HCS waivers. So just like the last session, you can utilize that question and answer box to ask your questions during the seminar. If you've got technical questions, you can ask them there as well. But put those questions there, and then at the end of this, we will have a question and answer portion of the presentation. So, Sarah, thank you for being here. We look forward to hearing from you.
Today, I'm going to talk to you all about the interaction between waiver employment services and Texas Workforce Solutions Vocational Rehabilitation Services. So the first thing to know is that Texas does have an employment first policy, and what that policy says is that employment should be the first and preferred option of service. That doesn't mean that everybody has to work in competitive integrated employment, but what it does mean is that employment has to be the first option of service discussed at any meeting. So if it's at an ARD meeting, if the person's in school, or if they're in a waiver at their service planning team meeting, if they're in an ICF when they do the update on the IPP, employment has to be the first option discussed. And the Employment First policy for Texas has been adopted by the Health and Human Services Commission, by the Texas Workforce Commission, and the Texas Education Agency. And HHSC's definition of competitive integrated employment is slightly different than our definition. You just heard from Paula what our definition is. HHSC's definition is pretty much the same, only they don't go into the detail that the Workforce Innovation and Opportunity does about the units. So in other words, Ability One or any of the super programs, the state use programs like WorkQuest, will qualify as competitive integrated employment if they are a job that pays minimum wage or above, offers the same benefits and pay as for all employees, typically not run or owned by an agency whose sole purpose is to support people with disabilities. And the interaction for people with and without disabilities is the same for everyone who works there. There do have to be people without disabilities employed at the business, so it can't just be a group of people with disabilities and a supervisor. It has to be people without disabilities and people with disabilities, but HHSC doesn't specify a ratio. So there are, in the home and community-based waivers, there are several employment services. The first is employment assistance, and that helps people find competitive integrated employment as defined by HHSC. There's supported employment, and that assists them in maintaining employment. And the class waiver has something called pre-vocational services, and that is only offered through class. And those services are designed to teach folks basically soft and executive skills, not to prepare them to do a specific job. And all the waivers in Texas have employment assistance and supported employment. Now, only class has pre-vocational. And all the waivers allow the participant to consumer direct the services. And here's the waivers in Texas. There's HCS, you're probably familiar with these, the deafblind with multiple disabilities, the Youth Empowerment Services, Texas Home Living Class, and the Medically Dependent Children's Program, which is now being run under STAR Kids, which is a managed care program. And HHSC is the administrator and operator for all these waivers. And depending on which waiver it is, there's different folks who carry out the day-to-day functions, different organizations that carry out the day-to-day functions, and different people who provide case management. So the LIDAs and the local behavioral health authorities provide service coordination, managed care organizations also provide service coordination, and private providers also provide case management. And as well as that, they all provide programming. We have 3 managed care programs in Texas. They're all under the State of Texas Access Reform, or STAR. There's STAR, which is regular Medicaid, basically, and there's STAR++, home and community-based services, and that actually is a waiver, but it's not it's still run by HHSC, but it's only run by managed care organizations. And there's STAR Kids, which has the medically dependent children's program. And managed care, as I'm sure you all know, is the way that we're providing Medicaid in Texas to almost everyone. There's a few frontier and rural areas that still do fee-for-service, but most of the state is under managed care for the provision of Medicaid. So everybody in these waivers has a service coordinator, HCS, Texas Home Living, STAR Kids, and STAR Plus. They all have a service coordinator. That's their case manager. And in HCS and Texas Home Living, the service coordinators are employees of a local authority. In STAR Kids and STAR Plus, the service coordinators are employees of a managed care organization. And under the Youth Empowerment Services class and deaf, blind, with multiple disabilities, those folks have case managers. For yes, the case managers are employees of the local mental health or behavioral health authority. And for class and deaf, blind, with multiple disabilities, the case managers are employees of private companies. So I know Kyle is going to send you these the PowerPoints that we're doing today and the handouts, and you might want to, if you're involved in home and community-based waivers, you might want to print out this particular slide because it shows the sequencing of services between TWS VRS and the waivers. And we're going to get into why there is this very complicated chart that you're looking at. Why is this? Because there are certain times when a waiver provider is required to refer to vocational rehabilitation by federal regulation. And we'll get into that in a moment. So there's a lot of myths about people on waivers and working. And the biggest myth is that they're going to lose their waiver if they go to work, and that's just simply not true. All the waivers in Texas, with the exception of Texas Home Living, have something called the 300% rule. This rule says that folks on waivers can have combined earned and unearned gross income of up to 300% of the federal benefit rate for the year. And the federal benefit rate is what most people know as supplemental security income, the maximum rate for that for the year. In 2019, 300% is $2,313 a month. And that's gross earned and any unearned income. And unearned income is income like Social Security disability insurance or disabled adult child or cash gifts someone's giving you, things like that. But on most of the waivers, not on all of them certainly, but on most of them, we don't see a lot of people exceeding this 300% rule, but we do see a lot of people being very concerned about going to work because they're scared they're going to lose their waiver slot, and they're just not going to. Because even if a participant has more than 300% in gross earned and unearned monthly income, they can always establish a qualified income trust or QIT and pay a cost share for the waiver services through that, or they could join the Medicaid buy-in, and the Medicaid buy-in allows folks on waivers and anyone on the Medicaid buy-in, but certainly on waivers, to earn over $63,000 gross this year. And they'll still get all their waiver services, and by the way, they won't have a cost share for services. And the Medicaid buy-in is an eligibility group into all those waivers listed in Texas. If folks are on Texas Home Living, they really kind of have to join the Medicaid buy-in when they go to work unless they're making very little income, because Texas Home Living doesn't have that 300% rule. They go on the supplemental security income fiscal rules and the Medicaid rules. So you can't have more than $2,000 in resources, and you can't earn very much money. So most people on Texas Home Living who go to work do join the Medicaid buy-in. The person who is responsible for actually coordinating all of that when somebody goes to work is not the waiver provider, really. It's not TWS VRS. It is the service coordinator for that waiver or the case manager for that waiver. One of their primary functions is to ensure the person's retention of Medicaid. And so to ensure retention of Medicaid, you really have to put all that fiscal information together. And so that's, again, one of their primary responsibilities is to do that. And HHSC is, last year, went out and did a training across the state, and this year they're going out again and doing trainings. If you're interested, go to the HHSC Employment First website. Just go to HHSC and type in Employment First, and that portion of their web will come up, and go to trainings, and you'll see where the trainings are. They're doing 13 of those this year around the state. And so they are helping the service coordinators and case managers and providers understand all this information so that folks on the waivers will take advantage of the employment services and will be able to work. So as I said, all the waivers have two discrete employment services, employment assistance and supported employment. But TWS VRS doesn't have anything called employment assistance. We have no such animal in our world. All the services that we do are really equivalent to employment assistance because that's all we do at TWS VRS is help people with disabilities find jobs. We also provide a service called supported employment, but it's not the same supported employment as the waivers, and that's always very confusing. So again, the waiver support service supported employment is to help people maintain a job once they've already gotten a job. TWS VRS supported employment is specifically provided to those customers with disabilities that we serve, that the counselor, the customer, and that customer support team feel that they may need what we call extended services, what HHSC calls long-term services and supports once they've gotten the job. So we have, if you look at that sequencing of services chart when Kyle sends you these PowerPoints, if you look at that, you'll see there's different benchmarks in TWS VRS. And we have 6 benchmarks in our supported employment, in VR supported employment. And at benchmark 5, all of our active services are completed, and the long-term provider, and that would be the waiver provider, or it could be state general revenue, if there's any of that from a community center. It could be possibly staff from an ICF. They're expected to take over and provide all the coaching on the job from that point on, from that benchmark 5 of our supported employment on, even though we have 6 benchmarks. So that's often confusing for folks who do waivers with VR. We do expect, and everyone, at least on the HHSC side, certainly HHSC expects this, that if the individual wants to pursue competitive integrated employment, that fact must be in their person-centered or directed plan and the implementation plan. If the person is on a waiver, the waiver provider should have units of employment assistance that the service coordinator or case manager has put onto the individual service plan, and the individual service plan is called something different in the different waivers. So you just have to know what it is, but an umbrella term is the individual service plan. And it is the service coordinator or case manager, again, who works with the individual and their family members, their friends, whoever their support team is, their guardian or their legally authorized representative, to create a person-centered ISP, individual service plan. And that's very important. If you don't know this, HHSC just got a very large grant from the Centers for Medicare and Medicaid Services to really delve into person-centered planning and make sure that all the providers of services funded through the Health and Human Services Commission are getting person-centered planning. And everyone on, if the person's on a home and community-based waiver, everybody on that service planning team has to be aware and agree that competitive integrated employment is a good goal for that person. That's really important. It can't just be that the person decided it, the service coordinator or case manager wrote it down, and nobody else on the team knows. Because we certainly at VR have had occasion that someone has come in and the service planning team has not agreed that employment is a good option. And, but the person has wanted employment anyway, so they didn't tell the service planning team. They might not have even told the service coordinator or case manager. They just come in to see us. We start the process, and eventually we find out that they're on a waiver, and then we get in touch with the service coordinator or case manager. They're like, oh, no, they can't be going to work right now for whatever reason. And so that causes a lot of tension between both of the systems, right? And it certainly causes a problem with that individual who wants employment. So again, the waiver service employment assistance is equivalent to most of what VR does. Everything we do is targeted. That's our sole reason for existence, is to help people with disabilities get a job in the community. The federal regulation says, and this is in every single waiver under the definition of employment assistance, the documentation must be maintained in the individual's record that the service employment assistance is not available to an individual under a program funded under Section 110 of the Rehab Act, that's TWS-VRS, or under a program funded under the Individuals with Disabilities Education Act. That's the school system. So what this means is that when a participant on a waiver says, I'm interested in going to work in the community, hopefully the service planning team and the waiver provider really dig a little deeper with that person, have a little bit more robust conversation. So why do you want to go to work? What interests you about working? What kinds of things might you like to do? It doesn't have to be very detailed, but just more than like the person saying, I want to go to work, in the service planning team or the service coordinator going, great, we're going to refer you over to TWS-VRS. We're expecting a little bit more of a robust conversation. But it does mean that before the waiver provider can bill for employment assistance, that the person must be referred over to TWS-VRS, or if they're under age 22 and still in secondary school, they must be referred to the school as well. This is a federal regulation. And once the individual has made contact with TWS-VRS or with the school system, either one, the waiver can then start providing employment assistance up until the time the individual plan for employment is signed. The individual plan for employment, and I believe you all have had some overview of VR services. The individual plan for employment is VR's version of an individual service plan. Okay, and so I know HHSC is encouraging, and we certainly encourage providers to do this. For one reason, if you're a waiver provider and you're not billing for this, you're kind of throwing money away, because you can bill up to $33.10 an hour for employment assistance, depending on which waiver it's in, up until the time the VR individualized plan for employment is signed. There is one exception to the rule. At the time the IPE is signed, the Individualized Plan for Employment, that's VR's plan, you have to stop billing waiver employment assistance, but there's one exception to that rule. And the exception is that the waiver provider can continue to bill employment assistance for transportation related to the job search and job placement, even after the VR IPE has been signed. This is because VR does not provide transportation to folks. We provide bus passes, we provide mileage payment, actual cash payments to people so that they can pay for gas to get to and from work, but we don't provide transportation to people to get to and from in job interviews or employment, because we are vocational rehabilitation, we're not vocational habilitation. And so one of the very important things is that our services are time limited. So once somebody gets a job, They certainly have to be able to get there to the job and get home on their own. And that's one of the things that our counselors will work with customers on, is transportation very early on in the case. But for waiver folks, this was an issue. And I worked very closely with HHSC, and we worked it out with billing and payments that waiver providers could bill employment assistance even after the IPE was signed, but only for transportation, because VR is just not going to provide it. So again, once you've, hopefully, you've completed a vocational assessment and an employment profile for somebody. As I said, at the very least, you've had a little bit of a robust conversation with the person about why they want to go to work and what interests they might have. But ideally, because the waiver providers are paid to provide long-term extended supports and services to folks throughout their life, you can, in rehabilitation, a vocational assessment and employment profile can be completed, and that's very helpful. And that's when an individual is really ready to be referred to TWS-VRS. We're not looking for people who are job ready. We're looking for people who are motivated, reliable, and dependable. And Paula touched on this a little bit when she was talking to you all. But motivated means that the person wants to go to work. They really want to go to work, and they want to go to work now. Reliable means that they know, to the extent possible, that some of the soft skills that are involved in work. You have to show up every day. You have to be dressed appropriately. Things like that. So that if you are in a rehabilitation program and you say, well, yeah, I am going to show up to work every day except every fourth Wednesday when my day goes horseback riding, that day I'm not going to go to work. If that's not somebody who's reliable, that's probably not somebody who's ready to benefit from VR services at this point in time. And that's something that the long-term services provider could work on with that person. And dependable means, again, to the extent possible, the individual knows that the item or service that they produce has to be produced in the way that the employer wants it produced and in the time frame the employer wants it produced. So that's what we're really looking for, is motivated, reliable, and dependable. So referral to us, if the person is on a waiver, is the formal responsibility of the service coordinator or case manager, but anybody can certainly refer to us. But why do you have to refer to us? Why couldn't you just use employment assistance? It's because you have that federal regulation I just read to you. And a state, the reason you have to stop providing employment assistance when the IPE is signed is because the state can't pay for the same service with two different pots of federal funding. And TWS-VRS is funded through the Department of Education, and the waivers are funded through the Centers for Medicare and Medicaid Services under the Department of Health and Human Services in Washington, D.C. So those are two entirely different federal funders, and we have entirely different federal regulations. We have different eligibility criteria, and we have different timelines. So everything about our systems is different. The thing that's the same is we're serving this person. We're both serving this person with a disability. But it's real important that we understand each other's systems because they are entirely different. Okay? So this is what's known as the payer of first and last resort. And if you happen to be a waiver provider, and I know some of you are, sometimes this is very confusing because you're told Medicaid is the payer of last resort, always. And that's true for Medicaid. And guess what our funder tells us? We're the payer of last resort, always. And that's the Department of Education. So we have two different federal funders telling both of us, you are the payer of last resort, and everybody else is the payer of first resort. And on a national level, we have tried, advocates have tried for many, many years to get the Department of Education and Health and Human Services to work together on this and issue some kind of guidance. And they, to this date, have not been willing to do that. They said the states work it out. So we have worked it out here in Texas. And for all services in the waivers, except for employment assistance, TWS-VRS is the payer of last resort. For employment assistance, we are the payer of first resort. And that's a long-standing legal agreement, long-standing agreement between the legal departments of HHSC and TWS-VRS. It took them 2 years to get to this, but they did. And they said, okay, TWS-VRS, payer of first resort for employment assistance. For everything else, the waivers are the payer of first resort. So the waivers, as I said, have a service called supported employment, and the waiver service supported employment, unlike TWS-VRS services, is long-term supports and services. It's what we call in VR extended supports, and it means that the person needs job coaching on the job or check-ins on a daily basis or weekly basis or, monthly basis, whatever it is, to maintain that employment. And we don't provide, VR does not provide that service, and no one should ever come to us for the waiver service supported employment, okay? And again, in every single waiver under the definition supported employment, you will see this language. In the state of Texas, this service is not available to individuals receiving these services under a program funded under Section 110 of the Rehab Act. Now, if the person is under 22 and still in secondary school, then you have to refer to the school system to make sure that they don't provide the waiver service supported employment, which we know that they don't, but HHSC and TEA haven't worked out the language for an amendment to the waivers, and VR and HHSC did work it out, and so that's what's in the waivers. Okay? So as I said, we have different benchmarks in our supported employment. We have those 6 benchmarks. Waiver providers have to be ready to provide HHSC or HCBS supported employment at the beginning of benchmark 5. In all our other models of service, we have 3 benchmarks, and at benchmark C, we have closed the case, and that's when, if there's any HCBS supported employment, it has to be provided. We always close folks when they have reached 90 days past stability on a job. So we're looking at people in the job for a period of time and then 90 days after that. And stability on a job is achieved when we have completed all our active services, when VR has completed all the services that are listed on that individualized plan for employment or IPE. So once we've completed those, we start this 90-day clock. And once that 90-day clock runs out, we close that case. We're done with that individual. We are done. And sometimes that happens. Our active services are completed again in supported employment at benchmark 5, but our 90-day clock doesn't start until benchmark 5, and we close at benchmark 6. For any other model of service, we close at benchmark C. So the services that are in the waiver services, employment assistance and supported employment. And employment assistance is job assessment, discovery, development, right? And there's obviously extended supports on the job or job coaching for the waiver service supported employment. But there's 2 very important services that are included in most waiver employment assistance and supported employment, and those are personal attendance services and transportation. Now, transportation is not part of the managed care long-term services or waiver services. So it's not part of STAR Kids or the STAR Plus HCBS, but it is part of all the other waivers. And personal attendance services is part of all the supported employment in all of the waivers, including the managed care. So if someone needs a personal attendant when they're on the job, and some people do, they might need a personal attendant and they might need a job coach. They might actually need 2 people on the job. But typically in waivers, the job coach does the personal attendance services, and that is all included in the definition of supported employment. Okay, so again, once that individual's made contact with us, the waiver provider can begin providing and billing employment assistance, which honestly, it just amazes all of us at HHSC and at TWVRS that waiver providers don't do this, because it's a lot of money that you could be making. Our timelines allow us up to 180 days. That's 6 months to develop an individualized plan for employment. That means that as a waiver provider, you could be billing for 6 months daily of employment assistance. It's a lot of money, right? okay? So suppose the waiver provider finds a job for the individual before we even do that individualized plan for employment, because we're not going to start looking for a job for somebody until that IPE is signed. And if the waiver provider finds that job, that's great. It means the individual doesn't have to wait any longer to start working, and the waiver provider just needs to let the VR counselor know that the person's landed the job, and we'll start the case closure process, okay? If the TWS VRS Employment Service Provider, or ESP, was the entity that helped the individual find the job, it's going to be important for you as a waiver provider, if you are that, to know which model of TWS VRS employment is being used so you can track the expected date of case closure, because, again, if it's at benchmark 5, you take over at that point doing job coaching. If it's at benchmark C, you take over at that point, right? And of course, you also, if you're a waiver provider, you know that it takes a little bit of time for HHSC to add the units of service. So you can't just say, oh, hi, HHSC, we need to go in and start providing job coach today. So can we have those units of service? That's not going to happen. It can take from anywhere from 10 to 45 days. So you have to plan accordingly. So it's really important to have good communication with the VR counselor. If the placement came through us and the person's receiving our supported employment, you need to start tracking the individual's progress on the job immediately and refer to that sequencing of services chart for the benchmark, because when somebody achieves benchmark 5, when you look at the sequencing of services chart, they can achieve benchmark 5 in 3 months, or it might take them 3 years. So how long it's taking them and when they're going to hit, really what you want to know as a waiver provider is when that person is going to hit benchmark 4, because when they hit benchmark 4, that's when you're going to make your request for approved units of waiver-supported employment from HHS. So it's really important to have really good communication with a counselor so that you know what benchmark that person is in, and also so that if they're having issues on the job, if it's taking them 3 years to get to benchmark 5, there's probably things the waiver provider can do to help that person in other areas of their life, right? Okay. So again, I've said this a lot, but it's really important that waiver services for supported employment start at benchmark 5, right? And as I said, there's 3 benchmarks in all our other models of service, and benchmark C, we have A, B, and C, and when we reach benchmark C in any other model except for supported employment, all our active services have been completed, the person has been employed 90 days, and we close the case, we are done. We're done, right? Okay. So that means that sometime around benchmark B of any other model of employment, that you are going to need to know, well, that person's reached this benchmark, and how long does it look like the 90 days might take 90 days, or might it take longer for someone to reach 90 days? Because at any point, we can stop the clock. We can freeze everything and freeze that count, that daily count, to go in and provide more active services to help the person maintain the job, to train them on new tasks, whatever it is, and then we start that clock again. We can start the 90-day clock again. So you see, it's not really cut and dry when a long-term provider is going to take over. You have to have communication with the VR counselor to know when that's going to happen. Okay. So suppose that individual got the job, great. You're billing supported employment because you're a waiver provider, terrific, and the person wants more hours on that very job, or let's say the person's like they are busing at McDonald's and they want to be the fry cook. And so the manager says, hey, you've been a great busser, I'm going to give you a chance to be the fry cook. What do? You just keep on billing supported employment. It's not a new job, it's new tasks or more hours. And that's all covered under the waiver service supported employment. So if it's at the same company, even if it's an entirely new job, like going from a busser to the fry cook, you still just continue billing HCBS supported employment, okay? But if it is a job at a different company, so let's say you're busing at McDonald's and a Taco Bell opens up across the street, and you say, well, I love Taco Bell, so that's where I want to go bus tables at lunch, right? And pretty much what you're doing at McDonald's is going to be exactly the same as you're going to be doing at Taco Bell. And honestly, you all as the waiver providers have faded out a long time ago, because the person's doing great, you're checking on them once a month, everything's fine. Well, guess what? This is an entirely different company, so you have to refer back to TWS VRS and start the whole process over again. Now, I did mention that we have up to 180 days to develop an individualized plan for employment in the case of someone who has a job busing at McDonald's, who's going to go across the street and bus at Taco Bell. If they were in service with us before, with TWS VRS, we can do eligibility and we can write the IPE within a half an hour. So we're not going to hold somebody up from getting that job at Taco Bell, right? But you do have to refer back to us, because that is the way it works. That's the federal regulation, okay? Now, HHSC does have other employment services besides the waivers. You know that there's folks living in intermediate care facilities for individuals with intellectual disabilities. These are often referred to as group homes. And if you are an ICF, you know that you're required to assist residents to achieve all their goals, including employment, but you aren't required to do job placement or extended supports or transportation to and from work. So it'll be important, if you are referring the person to TWS VRS and they are an ICF IID resident, that you come in, that your comprehensive functional assessment and your individual program plan has some ideas of where this transportation and where the extended supports are going to come from. Don't just, VR again is not, we're not magic. We don't have any magic like cabinet that has like transportation and job coaches for life in it. We don't have those. We serve, you know, close to 110,000 people last year, and of those people, 90% of them walked in off the street without any support at all. So if somebody has support, like they do in an ICF or like a waiver, that's why we're expecting a little bit more robust conversation. And so in the case of an ICF IID, it's the interdisciplinary team, and we hope that they will have that robust conversation, and we hope that they will do a vocational assessment and an employment profile on the resident before they refer over to us. And we'll work with you. We'll certainly work with you to come up with ideas about the transportation and ideas about how you can get extended support. But don't expect that we're going to have the answers, because we won't, okay? So, and we are looking to talk, if the person is a resident in an ICF, the person that we want to talk to is the QIDP, the Qualified Intellectual Disability Professional. That's who we want to talk to, okay? And you know, some LIDAs and some local behavioral health authorities have state general revenue to provide job placement and extended supports. And the local behavioral health authorities all have active treatment teams, and they provide job placement and extended supports through the individual placement supports model as part of evidence-based practice. And some LIDAs and local behavioral health authorities have supported employment units that provide job placement and extended supports. Some of them have supported employment units just for people with intellectual and developmental disabilities, and some have separate ones for folks with mental health diagnoses, and some have them all together in one unit, okay? None of the people, the ICF, the LIDAs, the State General Revenue, the LBHA, the active treatment team, folks with disabilities who are part of those active treatment teams, none of those people are required to come to TWS VRS. The only individuals who are required to come to us are those receiving services through a home and community-based service waiver, like HCS, Texas Home Living, CLASS, DBMD, YES, STAR Plus, STAR Kids. They're the only people who are required to come to us. Any of these people are absolutely welcome to come to us. We love to help people with disabilities find jobs, so not a problem, they can come to us. But we are expecting, again, because They do have, the folks who receive services on this slide do have staff supporting them. So we are expecting that staff to have a little bit more robust conversation. We're expecting the person to come in with some idea of what their interests are. And that can be, as you know, it's fine if the person comes in and says, I want to be an astronaut or a movie star. Our counselors are trained to deal with that. I mean, that gives us a lot of information about the person, and we can actually drill down and figure out what kind of jobs this person would probably like. It takes us a lot longer. The reason it might take us 180 days to get to an individualized plan for employment is because the person comes in and says, I really do want to work. I really do. I want to be part of, you know, the world, and I want to get out there and work. Great. What are you interested in doing? I have no idea. Well, the counselor will work with that person, but it may take a long time, and that's called the assessing and planning phase, because they may have to send them for vocational evaluations, they may have to send them for trial work experiences to try and figure out what their interests are. And because you all are providing services on an extended basis to these folks, we are hoping that you have a better idea of who this person is, a more holistic view of who they are, and what their interests might be. It doesn't mean that those interests are the end, will be the end job. Maybe the end job will be something entirely different. And maybe the person will discover that through conversations with the vocational rehab counselor. But it really helps if the person comes in not only motivated, reliable, and dependable, with some idea of what their interests are or might be on a job, okay? So, as I said, it's really important that if you're a waiver provider or an ICF provider, or you do state general revenue, if you're providing any employment services and you're referring over to TWS-VRS, that you stay in close communication with us, okay? And so you know how important it is to coordinate with all the other agencies about somebody's, especially HHSC, about continued Medicaid eligibility when somebody wants to work, with the school districts if the person's in school. And if you're a waiver provider, you know how important this is because you have to seek out all those third-party resources, the payers of first resort, right? But really devote time because, again, going back to the very beginning, we have, the entire state has an employment first policy now. And it says that employment should be the first and preferred option of service. So at any meeting you have with a person, discuss employment with the individual, and that's competitive integrated employment in the community. And discuss it with their friends and family about how they might go about obtaining this. And one of the ways is obviously a referral to TWS-VRS. If they're in a waiver, they have to be referred to us, but anybody else, we're an option, okay? And continue to explore employment at every single annual meeting you have with the person or any meeting you have with the person. And I can tell you that, you know, the way of the world now, the way of the human services world is employment, and that's what you all do at WorkQuest. So it's not going away. All the federal funders are really coming down very heavily on this competitive integrated employment for everybody. And certainly, I'm sure that you're all familiar with the CMS clarification of settings rules. It's going to be happening as of March 17th, 2022. And you can make modification requests for certain people, but even when you make a modification request for that person, CMS, the Centers for Medicare and Medicaid Services, if the service is funded through a waiver, is expecting the service planning team to discuss employment, even for a person who has a modification request, every single year, okay? So it's very important that you are able to affirm and explain how individuals can work and maintain medical benefits, and in most cases have an increase in income, and their rights to appeal. Very important that you explain they have rights, you know, and if a service is denied, they can appeal it, especially if they're on a waiver and it's a service that they're supposed to be entitled to get. Okay, so if you're thinking, well, gee, this is all great, except these people are on supplemental security income or a Title II disability benefit, like a disabled adult child or Social Security disability insurance, and they can't go to work because they're going to, I mean, maybe they won't lose their waiver slot, but they're going to lose their SSI or their SSDI or their DAC and their Medicaid and their Medicare. but you'd be wrong about that. So you'll want to get training on SSI and Title II to find out the truth behind the myths. And what I actually do, which I did not introduce myself this way, but I am certified by Social Security as a benefits counselor. And that's what I do, is I train people on Social Security benefits. And I put folks through a 5-day training, both our counselors and our community partners. We have numerous providers who have been through this training. And so they go through a very intensive 5-day training and then a testing process. And they become basically a subject matter expert on benefits and work incentives, because it is so important that you don't buy into all those myths about working and SSI. And here's just a little lagniappe before I wind up for you. This should tell you, if you think that's not true, I know they're going to lose it because I know somebody who did lose it. And I'm sure you do, and I'm sure they did, and I'm sure they had an overpayment, and I'm sure Social Security told them whatever they told them. But all those things probably didn't need to happen, and Social Security, unfortunately, was probably wrong. But did you know that people on SSI can earn this year in Texas up to $35,685 gross in income? And they remain an active SSI recipient, and they will continue to get free Medicaid. And if they are on a waiver and they're earning that much money, they're under a category called 1619B, SSI Medicaid, and they won't have a cost share for services. They're not subject to the surrender percent rule, and nothing happens to their waiver benefits. Now, if they're in ICF, you know, if you run an ICF or you work with people on an ICF, that's a little different. They may not come home with very much income at all, or any at all, because they're paying a cost share for services in an ICF when they go to work. But just don't believe everything that you hear about Social Security benefits, and don't believe almost anything you hear about it, because almost all of it, unfortunately, is wrong, and it stops people from going to work who are on waivers, living in ICF, getting services through a LITA. And it's really, really unfortunate. And I think that I offer this to Kyle, and I'd be certainly happy to do benefits training. And probably some of you are already signed up for our upcoming 5-day training in September. So you are welcome to come to that training if we have space available. So I think we're opening up for questions now.
Thanks, Sarah. Yeah, I do have a few questions that have come through, and if anybody else has additional questions, you can provide them. I will say that I went to the HHSC statewide training, one of those trainings that last year that Sarah was talking about.
You did, that I met you. You met me. We met each other.
I did.
Where did you come? Which one did you go to?
I was in Fort Worth.
Oh, yeah, of course.
On the campus there, yeah.
Oh, that's very odd training. Yeah, wasn't that big place like that nobody could find?
Yes, that's exactly the one. All right.
Oh my God! Right, where we had like 150 people signed up and 10 people showed up because nobody could find it.
I was one of the 10. Yeah,
I'm glad you were there, Kyle.
Well, I was going to say it was a very worthwhile training, so I'd encourage anybody who wants to know more to go to that. So one of the questions we got was, so are waivers obtained by the Texas employer or by the individual?
Oh, the waivers, so we're not talking about, we're talking about home and community service waivers, and they are obtained by the individual, and they are run by the Health and Human Service Commission here in Texas. And the reason waivers exist, home and community-based service waivers exist, is to have people, to let people who otherwise would be institutionalized, like in a state-supported living center, not be institutionalized but live in the community. So they get a wide variety, a menu of services that are everything from health and safety services to things like camp, horseback riding, you know, just all different kinds of employment services, lots of different kinds of services. It depends on each waiver provides different services. But the individual signs up for a waiver, they call it slot. So they sign up for the waiver slot. And they can sign up for a waiver slot by contacting the local intellectual developmental disability authority or the local behavioral health authority at the community center. And they will often, most community centers will sign folks up for all of the waivers that we talked about, but there's different numbers to sign up for different waivers. But most of the time, the community center will sign somebody up for all the waivers. There's a very long waiting list for the waivers. The shortest waiting list is for deafblind with multiple disabilities, and that's 4 years. The longest waiting list is for class, and that's 16 years. It used to be HCS, but it's not anymore. HCS is only 14 years now, so there you go.
Okay. And then how do you become a waiver provider?
Well, you have to be enrolled in Medicaid to become a waiver provider because it is a Medicaid service. And if you're interested in knowing how to become a waiver provider, I want you to get in touch with, and I'm going to spell this out for you. I'm going to give you the email of my friend over at HHSC who can get you the information. Her name is Netra Davis, and it's spelled N like Nancy, E, H, T like Thomas, R, A, dot Davis, D-A-V-I-S, 2, the number 2, so it's Davis 2, at HHSC dot state dot TX dot US. So it's NEHTRA dot Davis, DAVIS 2, the number 2, at HHSC dot state dot TX dot US. And she will get you information on how you become a waiver provider. And let me tell you that because you guys do employment services, the waiver providers will subcontract with you to do employment assistance and supported employment. And a lot of the waiver providers are desperate for people to do those two services, desperate.
Great. Well, thank you so much for being here today to provide that information. I thought it was great. So thank you everybody who participated. I think we'll wrap up this seminar now. Thank you all, and we will be sending out copies of my presentation and Paula's and Sarah's to everybody who attended. We'll get a list of everyone who was on the webinar today and send it out to you. If you have any more questions or anything, you'll see my contact information there on the screen. You can always get a hold of me or anyone here at WorkQuest to help you out with this. But again, thank you very much. We appreciate your attention, and this information will all be available on our website as soon as in the upcoming week. So thank you very much and have a great day.
Thanks so much, Kyle, and a big thanks to all of our speakers today for their insights. Before we wrap, just a few final notes. Kyle mentioned some of this already. Today's event was recorded. You'll be receiving an email with a link to access that recording when it's available, so check your inboxes for that. You'll also be able to access the recording at workquest.com, and like Kyle just mentioned, in addition, you'll also get access to the actual presentation slides themselves. Now, that email you receive will also include a link to a very brief survey that we hope you'll take. We'd really like to know your thoughts concerning today's event, so please be sure to take a couple of moments to complete that survey. Thanks so much for being with us today. That does conclude today's seminar. Have a great day.